everyone, this is Tammy Scott, Nursing Home Administrator. On today's episode, episode 3, we will discuss the Tridemic, the nursing strike, and everything else that goes around it. There have been a lot of issues around the Tridemic. If you haven't been watching or listening to the news or anything about the Tridemic, basically the Tridemic is basically COVID-19, the flu, and RSV. All three of these are basically respiratory illnesses. In order for you to know which one you have to go get tested. The only rapid test they have is for the flu and COVID. RSV right now doesn't have a rapid testing, but I will say this. RSV mostly have the runny nose, mostly the post-nasal drip, and stuffiness, cough, and mostly is found in children. So you kind of can distinguish a lot of it based on the post-nasal drip, and mostly with a lot of children. Like I said, you won't know until you really go get tested, because a lot of these symptoms are the same. The flu and the COVID definitely have similar symptoms. So it's very hard to distinguish the two. Most of the time they would say that the COVID have sore throat, but now you seeing a lot of increase with strep throat. So like I said, it's very hard to distinguish what you may have until you actually go get tested. And some individuals know they have strep throat when they open their mouths and see they have inflammation of the tonsils, and they probably see some pulse. But still, you need to go to the doctor and make sure you get tested, because they will swab your throat and take it to the lab. Of course, read it to see if you have any do you have strep throat. So make sure that you go get tested for that. Most of the strep throats that they are seeing is coming from children, but still, I know a lot of individuals have children, so of course adults can have it. You could definitely spread it. So please go get tested. Please go get tested. Is very ugly out here. You're talking about RSV, the flu, COVID, and strep throat. Oh my God, it's so much going on out here. Too much. But please, like I said, go get tested. So now that the nursing homes are dealing with the Tridemic, it's kind of different than the pandemic, because you have the main three illnesses that we have to now look for. But we used to the flu. So flu is not new to us. Of course, the COVID, due to the fact they have another strand of Omicron. So with the Omicron, they are saying that with the vaccination that everyone has, the new strand is not good. If you have any types of vaccination, which is good to have vaccination if you are vaccinated, but with the new strand that they have, it's totally different from the strand that they had last year. So please make sure you at least get tested. I made sure as administrator, I educate my staff and also the residents on the important understanding these illnesses, but it's their prerogative to get vaccinated or not. I do want to talk about when it comes to the vaccination. Some individuals are stigma around the vaccination, and my job as administrator, like I said, is to educate. There's a lot of things that have been happening around with the vaccination, and I want people out there to respect others' decisions when it comes to the vaccination, because there's individuals who have a lot of health issues, women who pregnant, who's planning on being pregnant. Also, a lot of individuals, their cultural beliefs. So we want to be respectful of this. So asking someone their cover status, like on the street or anything of some sort, unless you friends with someone, then you can ask them. But being in someone else's business, to do that is not okay. I tend to see that some individuals see a lot of individuals with their mask on, and they tend to think that individuals who have masks on is non-vaccinated individuals, and that's not true. A lot of individuals who wear the mask, even though they are vaccinated, they understand that the vaccination is not a cure. So they understand that there can be other individuals that's around them who are not vaccinated, or who are vaccinated, who can still carry the virus. And they also understand that their loved ones that they go around body might not be able to fight off the COVID virus. So they taking extra precautions to make sure that their family is safe. And there is nothing wrong with that. So I don't want anyone to look at individuals who have a mask on when they're in the public thinking that, oh, those are the non-vaccinated individuals. No, these are individuals who taking double precautions to make sure that their families are safe. So I want everyone to respect everyone's wishes when it comes to that, because you don't understand people's backgrounds, you don't know their religion, and why should someone have to basically explain themselves or their religion or their family or their beliefs to someone that they don't know? So I just want everyone to be respectful when it comes to that. So that's the reason why, as administrator, I make sure that I educate my staff, I educate the residents, and I also educate the new admissions when they come in, their families, about it, because a lot of families, they tend to ask if certain individuals are vaccinated, their roommates are vaccinated or not vaccinated. And quite honestly, I have seen going through the pandemic in a nursing home administrator, I have seen more residents get COVID who have the vaccination versus non-vaccinated individuals, because I tend to see a lot of non-vaccinated individuals taking double precautions. I'm not saying that at other nursing homes is different, but I'm just saying based on what I have seen. So, but at the same time, everybody's body is different. Everybody have different type of illnesses. So COVID, the illnesses, or the vaccination, all of itself can be different from a person to person. So I want everyone to respect everyone's wishes. So my thing is just to be extra precaution. I make sure I mask up every day when I go to work. It doesn't matter. I don't care. If I'm in stand up, I'm in my office or anything. If I have the door closed, then it's different. But once my door opens, everyone knows when it comes to Miss Tammy already have her mask on. I cannot tell someone else to wear their mask if I'm not wearing my mask. So you lead by example. So I always have my mask on. I learned to talk with my mask. I learned to breathe with my mask. Everything. It's very, very important that you learn how to breathe with your mask. You have to learn how to patience breathing. You have to learn how to talk. You have to learn how to project your voice when you talking with a mask. A lot of individuals like to pull down a mask so they can be heard speaking. Sometimes it's not you bringing the mask down for you to get heard speaking. You just need to learn how to project your voice and make sure your voice is clear when you having the mask on. And a lot of individuals have an issue with projecting their voice, making sure their voice is clear. So it's not the issue of you need to take your mask down and speak. Just speak up and make sure your voice is clear. So I never have an issue as administrator of speaking while I have a mask on. It doesn't matter what kind of mask I have on. I know how to speak with a mask, and I know how to breathe with a mask. It doesn't matter if I'm doing patient care, no patient care. If I'm in the kitchen or not in the kitchen, I know how to wear a mask, and I know how to breathe with a mask. So please learn how to pace yourself when it comes to wearing a mask. A lot of individuals think that because we started wearing a mask in 2020 that everyone should know how to wear a mask. No, some individuals have been wearing it incorrectly. So if they run it incorrectly and no one is telling them to correct themselves, they basically learning the bad way. They have a bad habit of pulling it down, taking it off, want to talk, want to speak, and all this other stuff. So I'm very, very strict when it comes to things of that nature. So please, like I said, when it comes to the mask, because people have masks on doesn't mean that they are non-vaccinated individuals. It's just double precautions. So I just want everybody to understand that. Plus, when you have the Tridemic is worse than the pandemic, because you, like I said, you have the 3 illnesses and you also have strep throat. So we want to be cautious on that. Please go get tested. Please go get tested. A lot of insurance are now allowing individuals to be able to contact a doctor electronically. You can go on, I know that I have Cigna, so I know Cigna does it. So you could be able to go on your phone, make an appointment, and whatever doctor is available, the doctor will call you back and let you know, like they'll let you know when the time has come when the doctor is about to get on. So you could be able to speak to the doctor. You can send a doctor pictures if you have strep throat or anything, or if you need to go to a live chat. They'll send you a link so you'll be able to go live chat with the doctor, so you can speak to the doctor, so you don't have to clutter up the urgent cares or the ERs. So if you have health insurance out there, please utilize this, because the doctor can send you your prescription straight to your pharmacy. It doesn't matter, because they're going to ask you what pharmacy you have before you go on to the doctor. You don't even have to fill out all that information, because you already have your information already in the system because of your insurance, and you already have your login information. So please utilize that instead of you quickly going to the urgent care and you quickly going to ER. So please, if you can, please utilize that. Plus, if you have kids or anything, and you know it's hard when you go to urgent care, you're going to sit there all day, every day. Believe me, it's better off for you sitting in your house and staying in your house and you waiting for their doctor to come, so he'll be able to look at your children if they have some type of strep throat or something of that nature. Because like I said, you can take pictures and they also can see you virtually. So they can tell if your tonsils are swollen and whatever you tell them. So like I said, that's very, very great to have. So if you have insurance, please utilize those services. Please utilize those services to keep you from going to the urgent care or ER. But if it gets to the point of it's hard for you to breathe, you vomiting or anything, please go to the urgent care or the ER. But if you don't have to and your tonsils is just swollen and you know you need some antibiotics, please use their services. Okay. Like I said, there was an issue more on the Tridemic. If you need more information on the Tridemic, please go to cdc.gov. They have all the updated information that you need when it comes to testing the 3 different illnesses, all of the symptoms that you might see, all of the treatments that you might need, and everything of that nature. Make sure you also look at CDC and check your flights, because a lot of flights are being affected because of it, and plus you also have the change of weather conditions. So please, as you can, make sure you check those things and see. And plus, if you're going to international, please make sure when you're booking your flight, you understand when it comes to the vaccination and non-vaccination. What are their rules when you go to a different country, and be cautious to understand that rules in different countries can change any minute. So you could probably be in the international for a week, and while you over there, some might change, or some might change in the United States. So please, like I said, be cautious and be ready for anything when you doing international traveling. Okay, like I said, the second issue that we had, of course, there was a nurse strike that happened in New York. It was two hospitals. I don't want to say their names. You guys are gonna look it up on their names. Basically, it was two hospitals that thousands of nurses that went on strike. So you asked Tammy, why are you speaking on the nurses on strike? The reason why I'm speaking on the nurses on strike is I want you to understand how it affects the nursing homes. So, like I said, the strike lasted 3 days. It ended Thursday. So, it lasted 3 days. The purpose of the strike was because of contractual issues. The nurses, of course, wanted to increase the pay. And they also wanted more staff nurses to be hired because of the staffing shortages. So those are main issues that the nurses was going on strike, and I want to talk about that. I really, really want to talk about that. How does that affect nursing homes? It affects nursing homes a lot, because I'm gonna tell you why. If those nursing homes that's around in that area, and these individuals that's in this nursing home who are elderly, they say they have COVID and it got extremely worse, or they have a stroke or anything, heart attack, anything, and they need to go to a hospital, and they are still breathing, but they need emergency treatment. Nurses going on strike at those hospitals affects it, because these individuals who need to go to their nursing home can no longer go to their hospital, can no longer go to their hospital. They are being transported to a different hospital. So they are going to another hospital. They'll probably be an extra 15-20 minutes or away. So it does affect the residents of nursing homes. It also affects the staff, because if these staff and nurses that's going on strike, most of these individuals who work at a hospital probably sometimes work at a nursing home. So if they're going on strike, they're not going to work at the nursing homes. So this strikes affects nursing homes. Some people probably see that it don't, but it really, really does. And so a lot of individuals say, well, what do we do? Or how do they handle it? When it comes to the nursing home, like I said, it's very, very strict. Very, very strict. So a lot of those nursing homes that's around those two hospitals, and or assisted livings or anything of that nature, I applaud them for making sure they speak to their nurses, they staff, keep everybody calm and everything. I applaud those administrators, because I know as an administrator it can be very, very hard to wondering, is your staff is going to do the same thing? So that could be very, very scary. So I appreciate all the staff who's in those nursing homes, assisted livings, or retirement homes, who stayed and who work under those type of conditions. It's our job to make sure that we come together, the hospitals and the nursing homes, to make sure that the patients and the residents get the best care as possible. I also want to talk about this is, a lot of people probably say, okay, the nurses who went on strike at the hospital, it can have an effect on nurses going on strike at the nursing homes. If you really look at it, the clinical team and the nurses basically already went on strike, kind of, sort of, at the nursing homes. I'm going to tell you why. Through agency. They want to get paid more money. If nurses continue to go through agency, then it will put nursing homes in a bind where they will have to reach out and they will have to get a contract with these agencies, because the agencies will take their employees. See, when you look at contracts when it comes to agencies, I know as a nursing home administrator, a lot of individuals that get contracts, they don't read the contract, they just sign what the agency have on their contract and say, okay. No, you need to read as administrator what's on that contract. You can tweak that contract. You can tweak that contract for your facility. Just like they have on there, if someone is coming to your facility and you no longer need them, if it's within 30 minutes or an hour, you still have to pay them the first, just like 4 hours. You still have to do that. Or if they do work there and you no longer need them, they at least need to be working for 4 hours. So just like they have things on their contract, you can put things on their contract. Basically, if someone on their side cancel a shift, they will be responsible to replace their shift. If they can't replace their shift, then they should pay you 4 hours. So why should you go without a staff when agency stated that you was going to get a person, but that person don't want to work? So, like I said, when it comes to the contracts, you as administrator can tweak that contract. You can tweak that contract by any means necessary. Even when it comes to the pay rate, you can tweak it. So a lot of individuals like, what's the pay rate? Oh, it's $32. Oh, it's $28. No, you can tweak it. Because if you tweak it, then they have it. They will let the nurses and the CNAs know, look, this is how much their pay rate is at their facility. Would you like to go? And then they said, okay, sure. So a lot of individuals or administrators and also companies are upset or how much they paying through the pay rate, is because a lot of them are not tweaking these contracts. Some of these contracts that they are having is crazy. I wouldn't do a contract that's up to 8 weeks. I would do an agency contract for 4 weeks. Because if you do it for 8 weeks and you finally get a nurse, and what if you just renewed this contract? If you renewed that contract, you have a whole 8 weeks that you have to work this person, and you losing out a lot of money. So it's very, very important for you at least to do 4 weeks. Do not ever do 8 weeks. That's too long, or even anything longer than 8 weeks. Do a renewal every 4 weeks when it comes to agency contracts. Not only that, you need to understand your competition when it comes to agency. So like I said, a lot of nurses, that's their way in the nursing home or going on strike, is the fact that a lot of them will leave the nursing home and go work at the agency. And a lot of agencies now want to give out benefits. So not only is the agency, a lot of people use that, oh, if you go work at agency, they won't give you any type of benefits. We'll give you benefits. We'll give you this, that, and third. But if the nursing home's benefit packet is not A1, a lot of individuals won't get it. So it's very, very important for the nursing homes to look at their health benefit packet to make sure it's affordable, and a lot of individuals love it. I have seen and heard that Starbucks medical insurance is way better than a lot of nursing homes health insurance. And that's wild to me that Starbucks medical insurance is very, very, very good. So we probably want to do better. If Starbucks got good health insurance, medical insurance, nursing homes should definitely be better. So I want to make sure that that we have great health insurance and medical insurance, dental, vision, 401ks, and all these other things. Also, it's also a thing that when it comes to agency, you also need to put on your contract. If the thing is, the agency have on their contract, if you try to steal one of their workers, you have to pay a certain amount of money. You need to put that on your contract. An agency stealing one of your employees, and they will have to pay for it. So a lot of companies need to start, not only when they do applications, they need to do a contract with the nursing staff that goes into the nursing home and have them to understand they have to work a certain period of time, or if they decided to go to a local nursing agency, then their local nursing agency will have to pay them a certain amount. Because a lot of individuals who they'll be living in that area, they'll leave the nursing homes full time and go work for agency full time just to come back and work at their nursing home. And nursing homes need staff so bad they would accept them. Only thing they do is say, okay, I want to give my 2-week notice. They give a 2-week notice and they'll go fill out an application. Go fill out an application with the agency. Next thing you know, they back in your building. I have seen that being an interim in nursing home plenty of time, where I went in interim. They have agency in the building. They now have workers who are agency, and these are good workers. Agencies have good workers, and next thing you know, I learned as administrator that this worker used to work here probably at a nursing home 3-4 years. They left. Now they back agency, and now they're getting paid good money. So then I have to ask myself, how did that happen? But then the corporate office say, look, we want to cut agency down. We would like to do this. We would like to do that. Fine. Let's cut agency down. Let's come up with a game plan. And that game plan is you will have to tweak that contract. You're going to have to tweak that contract. You are. You're going to have to tweak the contract. You have to do 4 weeks. You have to put things in that contract that will benefit the nursing home. You need to put 4 weeks tops. You can change the pay rate. If nursing home, the agency do not give you someone for a certain shift, and you already asked for that shift to be covered 2 days in advance or anything, and someone don't show up, then they should pay you for it. They should replace that person. And because you have to understand, what if you need an RN for an 8-hour shift and that person canceled on you and they can't get someone as an RN for 8 hours for that day? That affects you. It affects you a lot. That affects your PBJ. It do. It affects your hours. Not only does it affect your hours, state looks at that. You can get penalized because of that. So if you're going to get penalized for that and you're trying to hurry up and get someone to work those shifts, most of the time your RNs are going to be your probably unit managers or your department heads. So it's very, very important that you have department heads that can be able to take the cart. They'll be able to at least do a supervised, position, like 4 hours or 8 hours or whatever. And it's hard because you have department heads who already work their 40 hours or 45 hours, and a lot of them on weekends probably tell you they're busy with loved ones or someone else like that. So it can be very, very difficult trying to get someone to cover that shift. So you need to have something that's in there for you, because your DON is not gonna like it. The ADON is not gonna like it. So you at least need to have something in there to say, look, to your DON, because your DON gonna continue to look at you like, what we gonna do? What can we do? And as administrator, you want to keep humping your shoulders, because you supposed to know business. You supposed to know operation. You supposed to know the contracts. They don't supposed to know contracts. They supposed to say, we need someone here, staff. I'm gonna call them. They're gonna give us someone. I run the floor. But you as administrator need to know the contracts. They don't do the business side. You do the business side. So it's very, very important for you to say, look, you didn't get anyone. So they didn't bring anyone. Okay, they owe us some money. They're gonna give us some money. And if this happens again, or this certain amount of time, we cancel the contracts. So whoever they have, they can't work here anymore. And these individuals want your business, because you have to understand that as administrator, I know how much we pay. I know how much that we pay out to these nursing agencies. I know how much the nurses and the CNAs take home. So I know how much we paying out, and I know how much these agencies are making, and I know how much the CNAs and the nurses are taking home. That's my job to know this. So it's very, very important that you be able to see stuff like this. Not only do you need to see stuff like this, you also have a thing where you need to have on there that your nurses or CNAs need to automatically take a lunch break. They have to take a lunch break. It's the law. They need to take their break on their mind, their body. They need to take their break. Some of them tend not to want to take a break and want you to pay for it. No, you have to let them know, no, you have to take a break. I need you to take a break. It's important for you to take a break. It's a law for you to take a break. I need you to take that break. And for them to understand. But you have to let them know that you want them to take a break, because it's good for them on the mental side, for them to get some rest and make sure they eat. You talking about 12-hour shifts, 8-hour shifts, they need a rest. So you have to let them know, look, lunch breaks automatically get taken out. And sometimes I'm so good at it, like I tell them, look, lunch breaks get taken out. Make sure they form say that lunch breaks automatically take out. So you have to let them know, please take your lunch breaks. And you need to have a lunch break schedule for them to take out, to automatically take. Because if you waiting on a CNA or a nurse to take their lunch break, they'll take it late in the day or early in the day. So you have to let them know, like, this is your time for you to take a lunch break. Please make sure certain things are done before then, certain things done after, but please take your lunch break. But make sure these lunch breaks go around with certain showers that they have to do, smoke breaks if you have smoke breaks. So make sure that their lunch breaks intertwine with, the resident lunch breaks, smoke breaks, showers, and all that good stuff like that. Like I said, it's ways that you can, as administrator, you can compete when it comes to agency. It's just, as administrator, you will have to do the administration work. You will have to let your RDOs know, look, these contracts say this. This contract needs to say this. So when I came in as interim, that's the first thing I look at is the contracts. Why does contract say this? Why does contract say this? We need to tweak these contracts. Sometimes the contract be already for a year. It's nothing really you could do because it's already there for a year. Contracts are already signed. But if you are administrator and new contracts come in, please tweak those contracts. It's very, very important. Just don't let an agency give you a contract and you sign and send back. It's like, okay, you agree with them. Why you have to agree with them? They need your business. Tweak the contracts. It's important for you to tweak the contracts. And also, if you need certain timesheets to come in to you, because sometimes agencies, they get paid weekly and your staff get paid bi-weekly. So you need to let the individuals know of agency who is your contact person. You don't need 5-6 people to contact you. You need one staffing coordinator to be able to contact your staffing coordinator or your DON to make sure that certain individuals are in, and you need to be able to speak to one person when it comes to the business side of it, when it comes to the payroll. And you need to let them know, look, I need timesheets sent to me by this day. If you need timesheets in by this time, but I need timesheets in by this day so I can look at the timesheets. I can make sure they take their lunch breaks so I can sign off. If they timesheets do not have a signature, your signature as administrator, they don't get paid for it. It's very, very important that your signature go on every timesheet. You need to see this. There's been times where I was working at other nursing homes that there were times when people said some people sit still in time. Certain individuals came in and they really didn't come in. So I have had those issues. I really have those issues. Like I had issues with individuals that have the same name, worked different shifts. I had issues, any type of issues when it comes to staffing. I didn't have issues. I have issues where time she's supposed to be in a certain day. Certain individuals probably work early that week. They want to lag gag and want to bring the time sheets in on a Saturday, and time she's supposed to be in on a Friday. No, you have to let them know, look, I need your time sheets in this time. I don't care if you have to fill out your time sheets, take a picture of your time sheets and send it to the staffing coordinator and make sure they have the time sheets. I don't care. Just make sure your time sheets are completed, and one of the charge nurses have signed those time sheets to say that you worked them, because there have been some times where I have time sheets and charge nurses have not signed those. And so I still want you guys to please look at them, and please have them to understand when they take a lunch break or they leave the facility, that is a break. A lot of them say, Miss Tam, I left, but I didn't take a lunch break. But did you leave the facility? Yeah, that's a break. So if they leave their facility, it's a lunch break. So make sure that as administrator, you are looking at things like that. Okay? But make sure when you do your monthly meeting that you explain that to them. You have to explain this. You also have to make sure they sign when you do your in-service meeting. Make sure you type up an agenda, what you discussed, what you went over, and make sure it's on there, because you need their signature to say that, okay, these staffing agents know that you went over this, because the agency is going to say, well, we didn't know that. No one told us about this. Have you talked to them about it? You're like, yes, I talked to them about it. They was at the monthly meeting. They signed it. I went over it. Here goes the paperwork, and he can come their signatures. And they were like, okay, all right, you went over it. So make sure you speak to them before you go in and start making changes. Okay? So make sure you let them know at the monthly meeting, you let them know, like, look, starting, I'm going to give you guys 2 weeks or 3 weeks, or if you have a union, make sure you get them, like, whatever contract, what it say on contract, if it's 30 days or 60 days or whatever, you let them know, look, these are the changes that's going to happen. If you guys want to get paid when it comes to the timesheets based on the agency, this is what I need you to do. Staff, this is what I need you to do. So please do that. It's very, very important. Like I said, we talked about a lot of things today. I hope you guys enjoyed this conversation that we have. My job is to make sure that I educate individuals on what administrators go through, what they went through during the pandemic, and what they're still going through the Tridemic. So thank you guys for watching. This is episode 3. Thank you. You guys can follow us on all platforms. You can please go to the website at BLAHC.org, BLAHC. You got BLAHC.org on Twitter, on IG. You can type in BLAHC, BLAHC, period content. Please go to YouTube, type in BLAHC, BLAHC, to see any episodes. Please subscribe, like, share, comment, whatever. Please give your opinion about whatever you would like to give your opinion about. It doesn't matter. If you think that I should talk about certain things or you want to hear certain things, please, please, please. Anything is great. Anything. It doesn't matter. Tammy, I think you should talk you should talk about this. Tammy, can we see more of this? Tammy, can we see more of that? Sure. Like I said, I will be bringing individuals on to the platform on the episode, so you see us having a discussion about about certain things. Please, I need more subscribers. Once I get more subscribers, I can be able to go live, and I can be able to get the fans to come in, and we can have a discussion, a more broad discussion, more excellent discussion about everything. So please go and follow me. Follow BLAHC, the organization. You can follow me on LinkedIn. I'm also on LinkedIn. So I'm Tammy Scott, licensed nursing home administrator, LNHA. MHSA. So please follow me. Thank you guys so much. Thank you guys so much for watching. Me. Like I said, I appreciate every single one of you guys. I know we small right now, but we're gonna get bigger, and I see the potential. So thank you, everyone. Thank you so much. Bye.